I do want to say that this recording or this meeting is being recorded, so just want to let you know that. But one caveat I do have to say is this is for the Anthem Medicare Preferred PPO with prescription drug plans. So if you're currently in that, these benefits, except for one, are offered to you today, and they will continue to be offered in 2024. So I'm just going to quickly go over what Medicare is, the whole person care benefits and programs that we offer, as well as the digital tools and resources. And then upon every conclusion of my webinars, I do have a Retiree Resources, and we'll be expanding that into next year. So many of you already know this, but I just like to preface this as saying that a Medicare Advantage, you have the original Medicare, and that includes your Part A, the hospital, and Part B, which is the medical coverage. So Medicare does not include prescription drug coverage or your dental, vision, and hearing. What Lacers offers is a Medicare Advantage with Part D through Anthem. So that includes your hospital, medical, and prescription drugs, as well as many other benefits that we're going to be discussing today. So that's that single ID card that you have. It's just a simpler experience for you because you do get additional exams, and it's a one-stop shop with your card. We offer, silver sneakers and that routine vision and hearing, telehealth at no charge. So we'll go into those. As you may have heard, in 2024, Lacers will be offering a Medicare supplement lookalike that is alongside of this one. So once again, this only pertains to the Medicare Advantage with Part D. So I like to, I don't want to just call Anthem a payer of claims, because we are more than that. We are a healthcare delivery system. And so we look at you as a whole person. So we want, to offer you fitness, preventative care, and behavioral health programs that work together to address your needs. We make personalized connections. We do have access to Sydney Health on your smartphone. And if everybody can just maybe mute themselves, that'll cause a little less distraction for everybody in the meeting. Thank you. Okay, and so then there are, you have Sydney Health, and then you have extra care when you need it. So you're going to receive personalized messages and suggestions, and we'll connect with you on that. And you have a collaborative care team. And so we support you with one-on-one should you need that support. So let's talk about that whole person care benefits and what's offered to you today. So we offer a 24/7 nurse line. This is really important because if you don't know if you should go to the urgent care or if you can wait for your doctor, you can always call the 24/7 nurse line. Obviously, if you feel it's an emergency, you go to the nearest hospital or call 911. A 24-hour nurse can also help you, though, assess your symptoms. And then let's say you have a condition that you were recently diagnosed with, and you might have some questions, especially in the middle of the night. Sometimes I wake up in a panic. You might want to call and ask just about, maybe you have some questions that you haven't thought of before. So you can call that nurse line and talk to them about your course of treatment. And then they can also address any questions about prescriptions or over-the-counter medications, especially if you're feeling like they might be interacting. And that's just, until you can get to your doctor, but it is nice to know that it's 24/7 available to you. Many of you are familiar with Live Health Online. I love this app because I have used it in the past. I had something stuck in my teeth and I got an infection from it. I was able to clear that, but the infection remained. So I just called Live Health Online. I picked the doctor that I just felt, I feel comfortable with. And she was able to write a prescription to my nearest pharmacy. I picked it up and boom, that was all done. And it costs nothing. So you get the care that you need from your home. And so you don't even have to leave the house, especially if you're not feeling okay. So these are for common symptoms such as colds, flus, and sinus infections. I did have a colleague, I have mentioned this before, that her husband had the pink eye. They were on vacation, so she just called, boom, prescription, done. The really nice thing about this is that they also have video counseling sessions that are available to you. That is with a psychiatrist, a psychologist, or licensed therapist. So this is really important because especially after the pandemic, and if there are restrictions to go to and find a behavioral health specialist, this offers you that ability to do so. And so you can choose the doctor, you can do reviews, you can check the reviews, you can choose a male, a female, a psychiatrist, a psychologist. Once again, they are able to fill prescriptions. However, it is very limited, as you know, especially with the opioid pandemic going on, epidemic, sorry. So we do offer what's called the Medicare Community Resource Support. And this is really interesting because let's say you might need help with a fence that blew down and you don't really have the means to fix that fence. Well, you can give us a call and we can connect you with potential community resources around. So there might be a special project that's out there in your community that says, hey, we help veterans, we help anybody that there's certain differences. There's religions, there's cultural. So we also can help with food pantries, home maintenance programs, utility assistance, and social activities. So if you're even interested in, I don't even know where to start to find a bridge that I can go and play bridge with friends and meet new people, you can definitely call us for that and we can set you up or let you know about some social activities that are around your community. And I know you all may be familiar with the house call program. So Anthem does call you. And what this is, it does not replace your annual physical, and it does not replace your primary care physician. But what it does do is it checks on you in your home environment at no additional cost. So a licensed clinician will conduct a basic health screening at your home, and they're just going to do some blood pressure, some heart monitoring, and then this is the opportunity for you to take all of your prescription drugs, put them down on the table, and then she can actually, or he can actually go through those prescriptions and take a gander. You'll be surprised at how many you end up pulling down that might be from like 2015. So they just want to make sure that your prescriptions aren't necessarily interacting, especially because you don't need referrals in your plan. You may see a specialist and forget to tell your primary care physician that you're taking that medication, and it might have some interactions. So I highly suggest that you do take us up on the house call program, and you get a $50 gift card for completing that assessment. With the Medicare home lab kits, some of you may have received this at home as well. So this is a do-it-yourself testing in the comfort and convenience of your own home. A lot of people prefer the privacy, but there are multiple kits that you might receive depending on if you have not completed this with your doctor. So the colorectal cancer screening, there is a urine test to monitor your kidney health, and then the A1C blood test kit to measure your blood sugar. It is a posted page envelope that you just mail back to the lab, and then you and your physician will receive the test results from that. And there's silver sneakers. That's one of our favorites. So it's a no added cost for you to go to any participating gym, and you can go as many times as you like. So if you like one gym because they have a pool, or you have another gym because they do yoga, or they have a certain stretching exercise, by all means, you can go the same day. There's no limitations. The nice thing with silver sneakers as well is it works when you travel. So if you travel to go see grandkids or friends that are outside of California, it travels with you throughout the United States. Your number goes with you. You can either go on silversneakers.com or you can give them a call to find a local gym near you. The other thing I love about this is some of you may recall that we did an on-demand class where they actually did like a sample. They said, let's go look at these on-demand classes, and there's one for stretching and there's one for balance. So it's not even hardcore. It's some of the basic things that you might just forget about and say, let me go check this out. They have brain health activities. And then I really like the stretching one because I'm able to do it at my desk sometimes, where I can just stop and I have 5 minutes to be able to do those stretching exercises to kind of help. And the balance ones are really good too. And if you don't feel comfortable with doing any of those, they also have a home kit that you can call and request. And it's like a little mini at-home kind of kit for you. The Healthy Meals program is, so these are frozen, nutritious meals that are delivered to your home. You qualify in 3 easy ways. So one way is if you are discharged from the hospital, your case manager may suggest that you receive these home meals, or you can request them as well. If you are diabetic with an A1C over 9, you qualify for this benefit, and you can either call Anthem or talk to your doctor. And then if you have a body mass index that is 25 or more, or 18.5 or less, you qualify as well. So if anytime you have a question about whether you qualify because you're not sure, you can go ahead and give us a call and we can help set that up with your doctor. So if you haven't received your health and fitness tracker, I suggest you do that before the end of the year. And if you're not yet a member, then January 2nd, you can call us and order this. So it is a fitness tracker that you do receive. You get one every 2 years. And so if you got one in 2024, you are due for one in, 2022. When we first started this plan, you are due for one in 2024. So it does come with an online program. I had done a webinar on that, and you can find that as well on our website that I'll give you later. And it is an online program. It'll help you set your goals, and there are participating challenges in tracking your physical activity. So I highly suggest, if you haven't received one, or if you're due for one, go ahead and get that one. So assisted devices, I had done a webinar on this one as well. So you receive $200 on a yearly basis. You should have received your prepaid MasterCard. If you have not, and you are currently enrolled in the plan, please call the number on your back of your card and let us know. We can help set that up for you. Some examples of that approved assisted devices include American with Disability, like the toilet seats, grab bars, shower stools and seats, and then those hand showers. So that's just kind of a few of them. And there is a catalog, and I believe there is a new website or an app that you can actually download. So this is a new benefit for 2024. So this is not quite active yet. But for all members that are enrolled in the Medicare Advantage prescription drug plan, you have what we added was an over-the-counter benefit. So I know many of you are familiar with the extra covered drugs that you can get through your pharmacy through a prescription from your doctor. Well, we made this easier for you. So you'll receive a welcome kit. And if you already have this prepaid MasterCard that for the assistive devices through Nation's benefits, we're just going to automatically load this $30 on a quarterly basis onto that card. So there's nothing you need to do if you have that MasterCard. So once again, you'll receive $30 every quarter, and that can be used for in-store or for catalog ordering. So some examples of over-the-counter are your pain relievers, your first aid supplies, foot care, acne treatment, cough and cold medications, and any diabetic care that you aren't already receiving. So it really makes it nice because then you don't need to go to your doctor for a prescription and you can actually grab that Robitussin right off the shelf and pay for it with your prepaid card. So once again, you're going to get some more information on that if you either are newly enrolled for 2024 or towards that time period. Non-emergency transportation. So and I'm sorry about this. It's 12 non-emergency transportation trips. And that allows you to go to your medical, to your pharmacy, or to any Silver Sneakers locations. And I just like to say that if you're going to your doctor and they write a prescription and you need to go to the pharmacy, that is one trip. That is not going to be considered 2 trips. So the transportation company will bring you to the pharmacy at no cost. So the personal emergency response system, this is otherwise known as PERS. And so this is that in-home device that you can either wear around your neck or have at a convenient location in case you have an emergency or if you fall. At a push of a button, the emergency services will come to your home. So this includes one personal emergency response system for you, as well as monthly in-home monitoring. So the next 2 I'm going to discuss are Personal Home Helper and the Adult Day Center. So with this one, you do need a prior authorization from the plan. How do you get that prior authorization? You can give us a call or you can talk to your doctor. So a personal home helper is someone who it's a personal care attendant that can help you with some home-based chores. So such things as bathing, showering, light housekeeping. So maybe you have some dishes to do or you need some laundry to fold, meal preparation and medication reminders. So if you need help with at least 2 daily living activities, and daily living activities include such things as bathing, toiletry, or grooming, then you can talk to your doctor about getting a prior authorization. And with this one, somebody comes to your home. The benefit covers up to 124 hours a year, and that's up to 4 hours a day. So you get 4 hours a day, and the maximum is 31 days in a year, and you get reimbursed up to $100 per day. And it must be a licensed and state approved home helper. And you can have any information on that by calling the number on the back of your card. And the Adult Day Center is similar. So it reimburses up to $80 for each visit to a state licensed adult day center of your choice. So this does require prior authorization. So the nice thing with this is that you can call us and make sure that adult day center is reimbursable before you go ahead and use that benefit. And so once again, you need help with at least 2 daily living activities as determined and recommended by your care provider. So we'll go into some of our digital tools. Some of you may already be remember these, but there is an Anthem.com website that you can log into and register on your computer, or you can download the Sydney Health app on your smartphone or tablet. I really like the Sydney Health app because it uses GPS to be able to find in-network physicians. And so by either Anthem.com or Sydney Health app, you are able to view your benefits, just take a look and see what your explanation of benefits are. We do mail them out to you, but if you prefer, you can even sign up for electronic copies only, and it'll go through your emails. You can chat with a live agent during business hours, during the member services hours, and you can access your digital ID card. I like it because I know that I've lost my card before and I was able to email the doctor or fax them right there. You probably heard me talk about my family health record. This is one of my favorites, especially because you do not need referrals once again. I know that I've had specialists and they don't necessarily talk to my primary care physician. And so with the family health record, I was able to download and share my information with my specialist, as well as with my primary care physician from the specialist visit. So it is an overall view of your medical records, and I really like this one for my lab work. So if you don't have any of that information, especially because different labs have logins and then your provider has a login, but any Anthem claim, once it's submitted, will process and will download into your health history. And my health advantage is I just received one the other day. It's just some friendly reminders. Maybe it'll just tell you, hey, keep going on taking that maintenance preventative drug. It's going to tell you what that drug is. Keep track of your health and progress. And then it might make, maybe you forgot to take your annual wellness visit, and it'll say, hey, don't forget you have your routine, your annual checkup to do. And so they'll send you that as well. And some of you are familiar with these special offers. And so I do want to say how you access this is you do go, if you're registered on anthem.com, there's a care link, and then or care category, and you scroll down and it says discounts. So the one nice thing about this is there is a Puritan's Pride. It's like buy two, get one free, and instead of being opposite. So CoQ10 is a huge one that I hear about, and I think it's like $19 for 3 of the bottles. So something to check out if you're interested in. So this is the Retiree Resources. I always like to end with this one, just it tells you everything. So if you're a part of the Medicare Preferred PPO, and then there's the 24/7 pharmacy member services if you have any issues. And then we have, for those of you that are Part B only and you're part of the HMO and PPO, we have that number. The website for Lacers, it's a microsite through Anthem, is anthem.com/CA/Lacers Wellness. You have the Lacers Benefit Center, and then the Live Health Online, and the Hearing Care Solutions, because as you know, you have a hearing aid benefit that goes through Hearing Care Solutions. So I kind of went over that fast, but I will open it for questions. And I know, let's see, I'm going to check that.
Yes, we do have a couple questions in chat. Alvin and Deborah asked if they can get a copy of this slide presentation. I know that we record it, but I don't know if you send out copies of this at all.
Yeah, we don't send out copies, but and I'm a little bit slow because it's open enrollment time, but it will be recorded and up on the Lacers Wellness website that I mentioned, that anthem.com/CA/Lacers Wellness. And that is where you can find a copy of this if you can just give me a couple weeks.
Yes. And it will also be on YouTube since we are pre-recording it as well, but that'll probably be in like a week or so. We have another question. It says, good morning. This is from Laura Brosius. She says, when can I attend a webinar on Anthem PPO Life and Health Plan Medicare Supplement?
Okay, so we have those. There are actually live presentations as well as virtual presentations. And so the live presentation, there's one next week on November 2nd. There's a virtual one on Halloween on October 31st. Then there's another one live on the 7th and the 9th. So Catherine, do you know the website that they would be able to locate that on? It's honestly, the Lacers Well. If you have Lacers Well, you should be able to look on that and you'll be able to see that.
And the dates were also posted in Lacers update calendar for each one.
Perfect. If you get that calendar, it's on there as well.
Yes,
I have a question, Tammy.
Yes, ma'am.
Some of your slides indicated no cost. What about the overall Anthem Blue Cross Blue Shield PPO? Will that affect the overall cost that we have to pay for our overall insurance?
So I don't have that answer. That is a Lacers question about how much your insurance costs, because I know that everybody is different due to service hours and such. So you'd want to check with Lacers on what you will owe for 2024.
Okay, maybe Miss Betty can answer that.
And Betty, I think, I mean, I
You're
know,
on mute.
like I said, I know it
Yes,
depends
there.
on service hours and such, though.
What is the question, Mrs. Moore?
I was wondering, Tammy showed some slides that showed that there were no costs to different things in the program, you know, for Anthem, Blue Cross, Blue Shield, PPO Advantage. I was
Okay.
wondering, okay, with
Yes.
those slides showing some things, will this affect our overall insurance costs, what we pay in?
Okay,
these are
Mrs.
all-
Moore, that is a health question for the health staff. So I'm gonna put the health staff email, which is healthstaff@lacers.org. Let
Okay,
me add that to the chat.
thank you,
Okay.
Betty. And one more
You're
question.
welcome.
One more question for you also, Betty.
Yes,
Have the booklets gone
yes.
out yet for Anthem, Blue Cross, Blue Shield as to what changes are being made? Because I have not received one yet. That's why I was asking that.
Yes, ma'am. They have just started mailing them out this week.
Thank you.
They have just started. I asked Darnell that question, and he said last week they didn't mail them out yet. They're just starting fairly recent. Okay.
Thank you. And Tammy, one more thing about the
You're
trips.
welcome.
Tammy, about the trips to get to your doctor, pharmacist, or whatever. It offers 12 one-way trips. So if a person doesn't have a ride to get back home or wherever, then I think the focus is really on 6 round trips per
Yes,
year.
so 6 round trips, yep.
Thank
And
you.
then we have that Medicare resource support. If you use your 6 and you may need more support, then call us and we can try to see what's in the community to offer as well.
Okay, one more question, Tammy. It just came to me. When you mentioned the nurses, the doctors that may be on call, and the clinicians, are they working for Anthem?
The nurse line works for Anthem and the Live Health Online is separate. That's through Live Health Online.
Okay, and what about the doctors?
Live Health Online is completely separate. They're like Anthem doesn't employ doctors for seeing members. That's through Live Health Online.
Okay,
And so many telehealth docs are with different ones, because when I was with the previous employer, it was a different one than Live Health Online, but I was able to still see my doctor that I had come to know and trust on that website. So I just found her on Live Health Online, and so a lot of them are telehealth. They are kind of contracted with a lot of different ones. So
okay, thank you. I just want to make sure that I had that clear. Who's doing what for who?
yeah.
You know, as far as Anthem.
Yeah, and so we don't employ doctors. The only doctors we employ are medical directors that will review or help us with our case management, help us strategize with case management, help us get better in our programs. And so I also see there's a chat that I hear right. No referral is needed for NEMD. There is no referral needed. One important thing is you have in and out of network benefits at no cost share difference and no cost share at all to Lacers, to you as a member. It's very important that they must be Medicare allowed and they must be participating in the Medicare program. So for some of you that might be seeking mental health and you use a licensed marriage and family counselor, they are not considered a reimbursable provider under Medicare. However, in January 1st of 2024, that will be changing. So that's one example. And then some doctors have chosen to opt out of the Medicare program altogether. The majority of those are dental surgeons or psychiatrists because they don't want to write the scripts and have Big Brother watching over them. So Oftentimes you will find that psychiatrists are they opted out of Medicare completely, but they have to notify you that they've done such, that they are not accepting Medicare and you are taking sole responsibility for paying them financially. And we are not able and not allowed to reimburse for that. There's another question, is dialysis and infusion covered at no cost? And that is absolutely true. So, you have a $0 out-of-pocket expense, out-of-pocket maximum, which means you pay $0 and the plan takes over 100% because you don't have any costs with this plan for covered services. Anthem Medicare Preferred PPO covers everything Medicare covers. And then these benefits that I discussed today. And there you go. So healthstaff@lacers.org should you have any questions about your premiums. And then once again, there is, you can check the website or you can ask them about the four upcoming open enrollment. We already had one virtual. The next virtual is on Tuesday, October 31st. I think it's at 1 o'clock. I'm not quite sure. I know it's in the afternoon. And so it's at 1 or 2. And then in person on the 7th is Van Nuys, I believe. I don't want to mistake you. So let's just leave it at, you can check with them because I know the 7th. And
We have the schedule.
yeah, it's November 2nd, November 7th, and November 9th are in person. So you can look to see if there is a location near you. I know that the 7th is Ontario. The 9th.
So I have that information, Tammy.
So if you can put it in the chat.
Tammy, we begin on November 2nd. That will be at the Almanson Court.
There you go.
November 7th will be at the Doubletree Hotel in Ontario. I have the information. If anybody would like, I can email it to them.
Well,
So it begins on November 2nd.
Yep. There is a virtual open enrollment similar to this. You can call in, you can Zoom in on October 31st.
yes, and I did receive mine in the
Okay, let
email
me
that
see.
he updated to where everything is going to be held and the dates and all of that.
And there's a question about durable equipment
I'm
cards.
going
So-
to put this in the chat.
Thank you. So on the durable equipment goods, the card. So you are to receive a MasterCard and you can use that for nation benefits today. If you have discarded, lost, or your card was stolen, give us a call on the number in the back of your card and we'll help get you set up with a new one. We'll have to stop that other one and cancel that last card, and then we'll start new. And then for the fitness trackers, you can call the number on the back of your card. So for any of these benefits, call the number on the back of your card and we can help get you set up for that. And so that's how you'll be able to do that one.
In the event that you're
So
moving
we're
out
doing
of,
October 25th.
can you hear me well?
Yeah, it's echoing, but go ahead.
Yeah, I think somebody may need to be muted if it's echoing.
Okay.
I'm sorry. Okay, maybe it's better now?
Yeah.
Yes. Okay, in the
Okay.
event of you're moving out of California, let's say you go to Florida.
Yep.
How is the transfer? How do you do to get the insurance, the Anthem PPO over there?
Yep. So the plan works throughout the United States, and so you can just use your card. So I like to suggest that you use in-network providers because Anthem has control over that. If they try to say, no, we don't take it, we can call them and say, yes, you do, you're contracted for it. So what I always suggest to anybody who may travel to Florida, or if you spend half the year in a different state, is I do suggest that you find some local care. You want to get set up where you're spending a lot of time, because if something were to happen, the doctor's going to be like, I don't know you, I don't have your medical record, so go to urgent care. So, you know, your benefits travel with you through the United States, whether you stay here, move there, it doesn't matter. But we do have a national network, and we also have a international network. So if you're traveling outside of the country, then you have emergency and urgent coverage. So I highly suggest that you, and I'll put that in here, the chat, and it will be, let's see, everybody. It is called,
I hear they call different names in other states, like Florida doesn't call
yeah,
the
but
Blue Cross.
you don't have to worry about that. That's not for, they know how to work with Anthem. So like in Florida, it might be Florida Blue, but they're part of the Blue network. So you just give them your card and they know what to do.
Thank you.
And so you can check out the any international providers on bcbsglobalcore.com. And there's a question about when are you going to hear the difference between this and the Medicare supplement, and that is during one of the open enrollment presentations. There is no deductible on this plan. It starts January 1st, everything resets, you pay $0.
Thank you.
One
Yes.
more question for you, Tammy. On the prepaid MasterCard,
Yep.
that's the one with the $200, isn't it?
That is correct. And so you'll have $200 for nation's benefit that I had gone over in that one, assisted devices. But in addition to that $200, you'll have $30 loaded every quarter.
Okay.
And that is for your over-the-counter. If you have, you know, if you need contact lens solution, if you have, if you need cough and colds, that kind of stuff. But you want to make sure that it is reimbursable, because I know through my FSA card, omeprazole is not covered, and that's that proton inhibitor for acid reflux. So you want to make sure, and if you have any questions about what it is, you're going to get a welcome guide with that. And then of course you can call the number on the back of your card.
Mhm.
But when
Okay,
you get the
that's-
welcome guide, it'll explain more about the program.
Okay, that sounds good. So that $30 quarterly, that's an automatic thing that we don't have to make any changes to that card at all.
Nope, so keep your card.
Okay, thank you, Tammy.
Yes, my pleasure.
Mhm.
And then once again, you know, you can find out more about the differences. We're going to be going over your vision benefit, because as you know, with the Medicare Advantage, you have a vision benefit in that, but you also, everybody, all LACERS retirees has a vision benefit through Blueview Vision outside of that. So if you are with Kaiser, if you're with United Healthcare, everybody has the Blueview Vision benefit that is separate than the one that is offered through this plan. So you'll hear more about that as well during open enrollment. And if you sign up for Anthem, you get a welcome booklet. It depends on, because during open enrollment, you'll be getting your booklet probably mid-December. If you turn 65 in November 1st, and or, you know, if you're going to be 65, actually that's next week. So, and you're going to be enrolling November 1st, you get it within 7 to 10 days. And thank you. So once again, all the plans will be discussed. I mean, every plan, every carrier has their own open enrollment, but Anthem plans, the Anthem Medicare Preferred PPO, the Medicare Advantage, or sorry, the Medicare supplements, and then the early retiree plans will be discussed during open enrollment. And so you can check out online, or Betty put it in the chat about when those appointments are coming up. And if you can't make it in person, then go ahead and you can join on October 31st at 2:00. Okay. So if you have any other questions, you're welcome to contact Lacers and ask them. And Betty, I don't know if you're going to be doing the spin the wheel.
You're
I know-
muted, Betty.
He's on mute.
Oh, one more question.
Tammy, you have gifts today?
I do.
I have
I
one
not
more question.
obviously with me. I'll be mailing them.
Okay.
I never been in
So I did
Anthem Blue
not get a
Cross.
wheel prepared, Tammy.
What's that?
I have a question. I never been in Anthem Blue Cross. I always was with Kaiser for 40 years. It's for me like, going to Kaiser is just one hospital and they have it all.
Yep.
But Anthem Blue Cross will be different for me. How can I start that? How can I know where should I go? Or how do I meet my doctor or how to choose?
So that's, unfortunately, as an insurance company, we can't sway you to one doctor or another. If you've heard great things about a doctor, oftentimes, especially in the Los Angeles area, they are parts of medical groups. So you're welcome, like if, Cedars-Sinai is something that you're interested in, or UCLA, you are welcome to talk to those. The best way to find out is I hate to say it, but friends, family, and Google. There's a lot of reviews out there on doctors and health systems. So that's really nice to know about because once again, if you wanted to see a doctor in the UCLA health system, they generally will refer amongst themselves, but it doesn't have to go through the plan. We don't require referrals, but they may want to refer doctor to doctor.
One thing with me, Tammy, when I moved out of California, which I've always carried Blue Cross Blue Shield PPO, even living in California, because I like to select my own doctors. But anyhow, the thing was, if I moved out of state, I had to carry the PPO. If I stayed in Nevada, Arizona, or California, I did not have to carry the PPO. That was the way when I moved out and I left there in 2015. That was the way the system was working.
Yep.
So I don't know about today.
Yep.
But-
So if you are in an HMO plan, if you're planning on moving, you'll definitely want to talk to Lacers and make sure that that HMO plan is available to you outside. Because I know there's very, very limited restrictions on HMO plans.
Right. And again, it was only in those 3 states, Nevada, Arizona, and California, but I always carried a PPO. So, and again, I like selecting my own doctors.
Yep. And that's
Hi,
so.
Tammy.
Yeah.
Hi. I am aware of the nation benefit and the year is almost closing. And I wanted to get advantage of the $30 per quarter or $60.
$30 a
quarter.
quarter, but that starts January 2024.
Oh, okay. Good point.
I
Okay.
gave you guys a little cheating session before that. Well, we did one open enrollment and they found out there. Oops, sorry about that. But so yeah, that starts January. You'll get that $30 loaded on that card.
Yeah, but the nation one, I used it for a while and I haven't finished the total of $200.
Yeah, if you don't use it, you lose it. But keep the card because it replenishes with the OTC. And you'll get another $200 January.
Oh, is that right? Okay. Thank you.
And Dawn has the wheel of names prepared, so she's gonna go ahead and we're gonna call some names out to see who wins a prize.
Okay. So I need to be
And
made
the winner
host.
must be present.
Winner must be
Yes.
present.
I did the wheel of names pretty fast based on the attendance, people who
Perfect.
dropped their first and last name. So
Thank you.
yeah.
That's right.
Sorry if you didn't. I can share
So
screen now.
Dawn,
I
I'm gonna
have to
make
be
you
made
co-host,
host.
Dawn, so you could
Okay.
share. You could share your screen, Dawn. Thank you, Dawn.
Okay, thank you. Oh.
And this is the fun
There
part where
we
she gets
go.
to spin the wheel.
Dorla, Garma.
Is my name there?
All right.
Yes.
Darla
Darla.
Gama, is she
Felic-
here?
Felicidad.
Yeah, Felicidad.
Yes, I'm here.
Okay,
We
thanks.
have
Awesome.
Dorla.
Congratulations.
Okay, how many are we doing?
Thank
Three?
you.
Yeah.
We're doing 3?
Winner must be present.
Okay. Yeah, this is based off who told me their first and last name.
All right.
Elvin,
Elvin.
congratulations.
Congratulations.
Okay, last one.
Is my
We have
name
some-
on that, is my name on that spinner?
Yes, it is. Where
I
is it at?
see
Right
it. I
here.
see it and it's spelled correctly. Thank you, Betty.
That was me.
Good job, Dawn.
Okay.
Thank you.
And we'll have some great prizes at the open enrollment fairs too. If you guys can make it out, we'd love to see you.
Welcome. Alvin.
Alvin, congratulations.
Elvin and Debbie, yes.
Is
Dawn,
Alvin
if you
here?
can send me
Dawn.
that list because I need the first and last names. I have the
Alvin and
addresses.
Debbie is here.
Okay. Alvin.
So
Newman.
thank you all
Okay.
for joining us today, and I look forward to seeing you hopefully at one of the open enrollment meetings.
Okay, thanks. We'll see
Thank
you.
you.
Thank you for
Thank
coming.
you.
Bye.
Thank you, lasers and
Thank you so much.
Thank you. Bye bye.
Bye, guys. Thank you.
enjoy the rest of your week, everyone. Try to
That's a
stay as
nice
safe as you can.
presentation,
Thank
Tammy.
you.
Give it up for Tammy. Thank you all. Bye-bye.